Welcome to our deep dive on empty nose syndrome. Um, yeah, so I guess you're listening because you're interested in ENS. I know I am.
Yeah.
Just the name itself is kind of strange, right?
Mm.
An empty nose, but you feel congested,
Yeah, it is a bit paradoxical.
for sure. We've got a couple master's theses from Changgung University
Yeah.
to help us wrap our heads around this. Both of them using some pretty high-tech 3D modeling.
Yeah, those are really interesting papers. It's amazing what they're doing with that technology these days.
Yeah, for real.
Mhm.
So before we get into the specifics of the research, though, maybe we should take a step back and, for anyone who might not be familiar with this condition, what exactly is empty nose syndrome?
Well, imagine like you're constantly struggling to breathe through your nose. Like it's
Yeah.
always stuffed up.
Oh man, I hate that feeling.
Yeah, it's awful. But the thing is, when a doctor examines you, they see wide open nasal passages. So there's no actual physical obstruction. It's almost like this phantom traffic jam in your
That's
nose.
got to be so frustrating.
Yeah.
And you said this often develops after nasal surgery.
Yeah, exactly. ENS is pretty rare, but it often develops years after nasal surgery, particularly procedures where turbinates are removed or reduced.
Okay, so quick anatomy lesson for our listeners.
Hmm.
Turbinates, those are the bony structures inside the nose. They kind of look like little scrolls, right?
Right. And they're not just there for looks.
Yeah.
They play this like vital role in regulating airflow, humidifying the air we breathe, even contributing to our sense of smell.
So they're pretty important then. I'm starting to see how messing with them could cause problems. But hold on. Why would removing tissue and theoretically opening things up lead to this feeling of blockage? Wouldn't more space mean easier breathing?
Well, that's the big question, right? And that's where it gets interesting because researchers believe ENS is more than just a structural issue. It's about how the air moves through the nasal cavity and how our brains perceive that airflow. One of the leading theories is about disrupted airflow dynamics.
Disrupted airflow, what does that even mean?
Okay, so think of it like this. In a healthy nose, the turbinates create a little bit of resistance, a slight turbulence, and that helps to evenly distribute the airflow and stimulate those sensory receptors.
Right.
But when you remove or significantly reduce those turbinates, it's like taking all the speed bumps off a racetrack. The air just whooshes through without hitting those crucial sensory nerves. So even though there's plenty of air flowing, your brain doesn't register it properly.
So it's not just about the amount of air, but the way it interacts with the nose, almost like the nose is numb to the feeling of the air.
Yeah, that's a great way to put it. That disconnect between the physical reality of open airways and the brain's perception of blockage is at the heart of ENS.
Okay, that makes sense.
Yeah.
So if it's so poorly understood, how do they diagnose it?
Well, right now it's mostly based on the patient's symptoms, what they're reporting, and their history of nasal surgery. Doctors will use some questionnaires, things like the SNOT-22, SOT-NOT-25, ENS6Q. These help assess the severity of symptoms, but as you can imagine, relying solely on subjective descriptions, that can be really tricky.
Yeah, it seems like there's a real need for more objective measures, something that can actually show what's happening inside the nose.
Right.
That's where those master species come in, right?
Exactly. Both of these studies are using 3D modeling to bridge that gap between the subjective experience and the objective evidence. They're trying to create this visual map of ENS that can help us not only diagnose it more accurately, but maybe even predict how someone might respond to treatment.
Man, that would be huge for patients struggling to get a diagnosis.
Yeah.
Okay, so let's get into the specifics. Tell me about this first thesis. I understand they use something called 3D convolutional neural networks, 3D CNNs.
Right.
What are those, and how do they apply to noses?
So basically, think of it like facial recognition software, but for nasal cavities. They took a ton of CT scans and fed them into a computer and trained it to recognize the patterns. Like, these scans are from people with ENS, these are not. And over time, the computer learned to differentiate between them with remarkable accuracy.
Wow, so I'm picturing this computer scanning hundreds of noses like a digital detective looking for clues. How accurate was it, though? Could it really tell who had ENS just from a scan?
Yeah, the results were really impressive. The model was able to predict ENS severity based on 5 different symptom scores. We talked about ENS6Q, SLEEP-Ds, ENS, SN225, and SNOT-22. For all 5 scores, the accuracy rates were over 85%. 4 of them even hit 94%.
Wow, those are crazy numbers. But even the best technology has limits, right? Were there any cases where the model got it wrong? And what does this mean for the future of ENS diagnosis?
Those are really good questions. And yeah, you're right. No model's perfect. And this is still pretty early research. Definitely need more studies to validate these findings and refine the model. But it's a really exciting step towards a more objective and reliable way to diagnose ENS.
Yeah, absolutely. So what about that second thesis? How did they use 3D modeling to study the nose?
So they were focused specifically on changes in nasal structures before and after surgery for ENS.
Yeah.
They used a software called 3D Slicer. They created these really detailed models of the nasal cavity. Like they could zoom in and analyze the turbinates, calculate how much their volume changed after surgery.
So they were looking for a correlation between changes in the turbinates and changes in the patient's symptoms, trying
Exactly.
to see if certain structural alterations led to improvements or if they made things worse.
Yeah, exactly. Their goal was to create a model that could predict post-surgery structural changes based on how a patient's symptoms changed, and vice versa. Imagine a patient saying, "My breathing's much better, but I seem to have lost some sense of smell." This model could potentially predict how their turbinates had changed.
That's wild. It's like having a roadmap for ENS. So did they find any connection between those structural changes and the symptoms?
They did, and some of the findings were actually really surprising. There was one case study that really stood out. This patient who had multiple really severe symptoms, nasal blockage, crusting, difficulty sleeping, and after surgery, they saw complete resolution of those symptoms.
Wow, that's amazing. Sounds like a real success story.
It was. But there's a twist. When they compared the before and after CT scans, they found that the patient's nasal passage was wider before the surgery. It seems like having a too open nasal cavity was actually part of the problem.
Wait, really? You'd think a wider passage would make it easier to breathe. How could removing tissue and making the passage smaller actually improve things?
Yeah, it's counterintuitive, isn't it? It challenges what we traditionally thought about nasal airflow. But this finding actually aligns with some other research that dives into the nuances of how air moves through the nose. We'll get into that in a bit. But were there any other interesting findings from the second thesis? There's one more that I think you'll find interesting. So they discovered that the degree of turbinate reduction didn't always perfectly correlate with symptom improvement. Sometimes patients with significant turbinate reduction experienced very little symptom relief, while others with less reduction saw really dramatic improvements.
So it's not just about how much you remove, it's about what you leave behind and how that affects the overall airflow.
Right.
It's a delicate
It
balance.
is. And it highlights the need for a more personalized approach when treating ENS.
Well, this has definitely piqued my curiosity. I'm starting to see how complex and under-researched this whole thing is. It's not just a stuffy nose. There's this whole cascade of physiological factors at play. Listeners, we're going to be right back to delve even deeper into the world of empty nose syndrome.
So before the break, we were talking about that surprising finding, a wider nasal passage actually contributing to ENS
Yeah,
symptoms.
it's like removing those speed bumps on a road and ending up with worse traffic somehow. It doesn't quite make sense.
Yeah, exactly. But this whole counterintuitive thing actually lines up really well with a study from back in 2017 led by Chengyi Li.
Okay.
They used 3D modeling and something called computational fluid dynamics, CFD.
CFD. I've heard of that, but honestly, I don't really know what it is.
Right, so it's basically using computer simulations to visualize and analyze how fluids move through a specific space, in this case air. So imagine creating a virtual model of a nasal cavity and then releasing a stream of digital air to see how it flows.
So they're building these digital noses and running experiments on them.
Pretty much. Yeah.
That's really cool. What did Lee's study show about the airflow in patients with ENS?
Well, they simulated airflow in these virtual noses of patients who had turbinate reduction. And they found something really surprising. The area of the nasal passage had increased, which is what you'd expect,
Right.
but the velocity of the airflow actually decreased.
So more space, but slower air movement? That doesn't sound like a good thing.
And it's not. Remember those sensory receptors we talked about?
Yeah.
They need a certain amount of stimulation to signal to the brain, hey, we're breathing.
So going back to the speed bump analogy,
Yeah.
are you saying that the turbinates, by creating that turbulence, are actually kind of like waking up those sensors?
Yeah, that's a perfect way to put it. The turbinates create microturbulence, and those tiny swirls of air are what stimulate the nerve endings.
Hmm.
Like a gentle breeze across your skin, you feel it, you register it.
Right.
But when the air is moving too slowly, it's like this really faint draft. It's there, but your brain doesn't really process it as breathing.
So even though there's more space for the air to move through,
Mm.
the nose isn't perceiving it correctly. That's what leads to that feeling of blockage.
Exactly. And this whole disrupted airflow thing can also explain some of the other common symptoms of ENS. Like slower airflow can lead to dryness because the air isn't being humidified as effectively.
Makes sense. And this is really painting a clearer picture of what's going on inside the nose with ENS. It's not just the amount of air, it's like the quality of it and how it interacts with all these structures and sensory systems.
Totally. When that balance is disrupted, it can have a domino effect on how your nose functions.
Okay, so we've covered a lot of ground here. Disrupted airflow, sensor perception, those 3D modeling studies. It's clear that ENS is really complex and multifaceted. But what about treatment? What can people who are struggling with this do?
That's a great question. And the answer isn't as simple as we'd like it to be. You know, because ENS is still poorly understood, treatments usually focus on managing the symptoms, not really addressing the root cause.
So more like treating the symptoms of a cold rather than finding a cure.
Yeah, kinda. Some common approaches are things like nasal irrigation, saline sprays, lubricants like petroleum jelly, those kinds of things.
It sounds like those might help with the symptoms, but they're not really getting at the underlying problem.
Yeah, they're like putting a band-aid on a bigger wound. But there is some hope. Some surgeons are exploring more targeted therapies that aim to restore the function of the nose.
Okay, that's good to hear. What kind of therapies are we talking about?
One promising avenue is surgical reconstruction of the turbinates.
Oh, wow. How do you rebuild something that's been removed, though?
Will they use grafts, cartilage, or other materials to try and rebuild those delicate structures?
Are they seeing good results with that?
It's still early, but the initial studies suggest that it can lead to big improvements in airflow and sensory perception.
That's awesome. And I'm thinking that those 3D modeling techniques could be really useful in these reconstructions.
Absolutely. Surgeons can use those models to not only visualize the patient's anatomy, but also to simulate the airflow and predict how different graft placements might affect things.
It's like custom tailoring a solution for each patient.
Exactly, that's the future of this field. Moving away from those one-size-fits-all approaches and toward more personalized treatments that address each patient's unique challenges.
When we started this deep dive, I had no idea how complex and fascinating the nose really is. We've gone from this simple idea of an empty nose to exploring airflow dynamics, sensory perception, and now even surgical reconstruction with 3D modeling and computer simulation.
Yeah, it's pretty wild.
It just goes to show that there's always more to learn, even about something as familiar as our own noses.
That's for sure.
Well, listeners, we're going to be right back after a short break to wrap up this incredible deep dive into empty nose syndrome. Man, we've covered a lot of ground in this deep dive into empty nose syndrome. It's kind of crazy to think that something as seemingly simple as, like, an empty nose can be so complex, and it can have such a huge impact on people's lives.
Yeah, it really does make you think about how interconnected our bodies are. How one little change can trigger all these other effects.
Totally. And speaking of effects, we've talked a lot about the physical symptoms, the blockage, dryness, the breathing difficulties. But what about the emotional and psychological toll? That's got to be tough too,
Well,
right?
absolutely. That's something that often gets overlooked, unfortunately. Imagine feeling like you can't breathe, even though doctors are telling you there's nothing wrong. It can be so frustrating and isolating.
Yeah, it's like having this invisible illness that no one else understands.
Exactly. And that lack of understanding can lead to a lot of anxiety, depression, even hopelessness.
It makes sense. If you're struggling to breathe all the time, it's going to affect your mental health.
It really does. And that's why it's so important for people with ENS to have a strong support system. Friends, family, therapists, people who can provide that emotional support and validation.
Yeah, I couldn't agree more. It's so important to feel heard and understood, especially when you're dealing with something that's often misdiagnosed or dismissed.
You know, Thinking about these studies, what really struck me is the potential of 3D modeling and AI. Not just for diagnosis, but maybe even for treatment.
Yeah, it's pretty mind-blowing. We talked about how they can help surgeons personalize treatments, but what other possibilities are there? What's on the horizon?
Well, one thing that I'm really excited about is virtual reality simulations.
Oh, wow.
Imagine a patient being able to step inside a 3D model of their own nasal cavity. They could see the airflow patterns, even experiment with different surgical approaches.
It's like a flight simulator for your nose.
Exactly.
That can be so helpful for patients to really understand their condition and make informed decisions.
Yeah, and it could also be a great tool for surgeons to plan and practice those really complex procedures, could lead to much better outcomes.
So as we wrap up this deep dive, is there anything else you want to leave our listeners with? Any key takeaways or things to think about?
Well, if there's one thing I hope everyone takes away from this, it's that Empty nose syndrome is a real condition. It's debilitating, and it deserves attention and understanding.
And that there's hope. While there's still a lot to learn, researchers are making some real progress in understanding and treating ENS.
Right, and I would also encourage anyone who thinks they might have ENS to be their own advocate. Do your research, ask questions, and find specialists who are familiar with this.
Knowledge is power, right? The more you understand about ENS, the better equipped you'll be.
Exactly.
Well, you've been listening to The Deep Dive, and we hope this exploration of empty nose syndrome has been informative and maybe even a little bit empowering. Until next time, keep diving deep and keep those minds curious.